JJ Staiano. I'm a consultant plastic surgeon and I run the Staiano Clinic here in Birmingham. I've just seen a patient with some lumps on her forehead and she's keen to have them removed. So I've taken her up to the minor operating suite now and I'm going to remove them for her under local anaesthetic. So the first step is to mark the lesions. We always mark everything before we remove it, and that means I have to get a pen and I delineate where the cyst or the mole is. The reason I do that is because when you put the local anaesthetic in, it blurs the boundaries, so you have to mark it first. Now I'm going to ask this lady to raise her eyebrows and to try to get to see where the creases in her forehead are, and she hasn't got any, so I have to put it in a place where I think there will be a crease in the future. Put the local anaesthetic in, stings a little bit, but then after that she doesn't feel any pain at all. Then I make a little incision over the cyst. Now this is the lesion that's underneath the skin's not involved, so I don't have to cut any skin out, so I can just make a little incision over the cyst. And I make it as small as I can, but this does make it quite fiddly to remove the cyst. Ideally I want to leave the wall intact, but in this situation the wall is breached. You can see the material from the inside of the cyst is on my blade and I'm having to wipe it off the blade periodically, but I have got the cyst in my forceps, the cyst wall, because the trick with this operation is to get rid of the cyst wall. If you don't get rid of the cyst wall, the cyst can come back. So I've got the cyst wall and then I can remove it completely to make sure the cyst doesn't come back. Once the cyst wall is out, then you use this little machine with the blue forceps, which is called a bipolar machine, which will cauterize any little blood vessels, and then I'll stitch up the skin with a non-dissolvable suture to give her the best scar. I always start from the edges first, so I'll do one edge and then the other edge to make sure that edge is nice and flat, so I don't get a dog here, which is a little bump at the end of the scar, and then I suture the middle. Go to the other cyst. There's a very small one here. Now this is really tricky because the cyst is so small. I want to give her as smaller incision as I can, but that makes it really fiddly for access. So you can see that I made a really small incision here, but I've still managed to get hold of the cyst wall and remove that cyst wall for her. And similar to the other side, I use a bipolar and then I put a stitch in the skin, and this one just needs one stitch in the skin, and that should leave her with a nice, very neat, small scar, which hopefully will be difficult to see once it fades. Thank you for watching today's video, and as ever, thank you to the patient for allowing us to video it. If you have enjoyed it, please check in later or subscribe to the channel.